Chinese state media shows an around-the-clock effort to build 2 new facilities, each with room for 1,000 patients or more.
Last night, the workers worked all through the night, and another shift of workers started to work at 2 a.m.
These scaled-down hospitals will concentrate solely on isolating and treating coronavirus patients. Prefabricated parts help construction go faster. The speed is impressive, says Johns Hopkins University senior scientist Eric Toner.
Well, I think it's remarkable that China can put together any sort of facility in such a short period of time. They did this in 2003 during SARS. They built a 1,000-bed facility in 6 or 7 days, and looks like they're actively doing it again.
The Chinese military helped build that facility outside Beijing. State media says it treated about 1 in 7 SARS patients and had a much lower death rate than other healthcare centers. Chinese officials say they are modeling the new centers on that experience. The facilities are badly needed, says Harvard University health policy professor Winnie Yip.
Most tertiary hospitals, large hospitals in China, are very crowded and overstretched, even during normal times. So during an epidemic, I can imagine that more beds are needed.
Yip says China has been focused on building big hospitals in urban centers, not community clinics that focus on prevention.
In the long run, China should build a stronger primary health care and public health system that would actually prevent something like this happening at large scale, and also people getting detected much earlier. But at this moment, the primary healthcare system in China is relatively weak.
Yip says the government is working to build up primary care, but that will take time. In the meantime,
China is actually sending teams of doctors and nurses from the military hospital system, of which China can quickly mobilize. And many other provinces and cities are also voluntarily sending their physicians to help.
And construction continues night and day as Wuhan aims to open 2 brand new coronavirus treatment centers next week. Steve Baragona, VOA News.